Hello everyone, welcome back to my YouTube channel, welcome back to another episode. You're joining me in the resus department in Lewisham Hospital. It's currently empty. We've had a deep clean of the department. It's early in the morning, we're about to start our day. We're expecting obviously a lot more patients to turn up as the day goes along. Today in this episode I want to talk to you a little bit about some of the experiences that nurses have on the front line. I'm going to be talking to nurses and getting their first-hand experiences of what they've gone through over the last few months, and also try and give you guys a little bit of insight into how important nurses are on the front line. They're varied in their roles. They do all sorts of different kind of things in the department and around the hospital, and I really want to give you an honest insight about that. Just so you've probably had a look around before, but this is an example of the resus bay, if you like. So we have our bed. If a patient comes in on the trolley, an ambulance trolley, we transfer them, we assess them here. We've got our kind of hub of stuff here. So we've got a suction device if it needs any suctioning of the airway. We've got oxygen here, which is fed through central pipe. We've got a cardiac defib system in the back here. We've got monitoring stuff. So all of our monitoring equipment's here. So we can look at blood pressure, oxygen saturations. We also have everything we kind of need is in these drawers, all the way from airway kits to cannulas and basic stuff like that, and also obviously our gowns. So yeah, I thought I'd show you a little insight. But now we're going to get on with the episode. I'm going to go and speak to some of these incredible nurses and my good friends as well. While it's quiet, I thought I'd take a moment to speak to some of my colleagues and get kind of an insight into what the mental health aspects of this pandemic are for staff. We know that the things we're seeing are really difficult. I've seen things that have really affected me, and looking after your mental health is hugely, hugely important. So I'm going to take you over to have a chat with one of my good friends over here and colleagues. This is Orlando. Orlando is one of my good friends, but also a very experienced nurse here at Lewisham Hospital. You've worked here for a number of years.
Yeah.
5 years.
Yeah.
I've been here for 4 years, so I've known you for a long time.
Yeah.
We've experienced a lot in A&E, and we see some things that are really, really difficult. But how does this pandemic compare for you?
Oh, it's totally different because I came from the Philippines, and we always wanted to visit our family and friends home. I see to it to visit them at least once a year. Mm-hmm. And now that this happened, that means we're pretty locked down. We can't even go outside. So this is a huge adjustment for us. So.
And for staff, because we are seeing things are really difficult. And, as nurses, you're used to caring for patients and providing, the emotional support as well to families. There's an element that's kind of pulled back a bit, isn't it? Because of the PPE and the gowns, the restrictions in terms of visiting. How much does that affect you, in your mental health? Because you want to care for these patients.
Oh yeah, definitely. You can't really help it. You're all covered up. All you can see is just eyes, and you wanna cheer the patient up, definitely. But it's really hard,
It's
but
tough,
you have to try, with other gestures, like for example, you ask them for tea and stuff, whatever they need, just for them to be comfortable. Yeah.
That's something we're trying to do. I've been working hard alongside the other staff here to get mobile phone handsets that we can use to allow family members to video call their family and speak to them, because that can be a real help as well. One of the things we've actually been trying to do is to get hold of some phone handsets so that families can video call their relatives if the relative doesn't have a phone. We're trying our best to do these things to help, but it is really challenging. How do you look after your mental health during these times?
For me, I always look after my mental health by looking forward to my day offs.
Yeah.
I have day offs. I spend my time with my family.
Yeah.
And I see to it that I'm in the present.
Yeah.
Okay. And I always do this. I have a habit of waking up early. I have a list of the things that I am thankful of.
Yeah.
It says that if you trade your expectations with your appreciations, you're always going to be happy.
I mean, that's some fantastic advice. We're all very lucky, and we need to look after our family and our health. Thank you, Orlando. You're a star. Right, everyone. So I'm joined by Peter, who's an advanced clinical practitioner, a very experienced nurse, and a good friend of mine as well. And you're also is it a lead in the department for St John's Ambulance as well?
St
John Ambulance.
Yeah, St John Ambulance. So I'm the clinical lead and event lead for West London.
Pretty cool, really. You're a very experienced guy in A&E and caring for patients outside of the hospital as well in different settings. So I thought you would be a great person to talk to. Today we're kind of trying to capture some of the experiences of nurses on the front line. I've not captured as much insight from nursing staff as I'd like to, so I'm dedicating this episode to you guys because it's very much deserved. How have you found things over the last few months on the front line?
So I think the response has been amazing. I think everyone's just pulled together. Everyone is so positive. Teams from our orthopaedic department are really supportive, helping see some of our minor injuries that we're still seeing as part of business as usual type patients, and everyone has just pulled together. The response from Lewisham and Greenwich has just been amazing. St John Ambulance is just out there serving their communities, and it just shows what a great country and a great NHS we have.
Yeah, definitely. And I think one of the things I'm trying to kind of explain to people at home is how closely doctors and nurses work together. I mean, it'd be very interesting, I think, for viewers if you could explain what your role is, because you are, very advanced and you actually work in the same role as we do, really.
So basically, with additional training and education, with supervision from consultants, we've developed skills to work and see the same type of patients as an emergency medicine doctor would, and we do the same competencies as the junior middle grade doctors in the NHS.
Absolutely. And you're using, so they use the same portfolio that I'm using in my kind of training as well. We work very closely alongside each other, because I think traditionally the idea of what a nurse is, just giving medications, that just isn't the case, and particularly in emergency medicine, in A&E, we do work very, very closely, don't we?
Oh, the teamwork in A&E is just amazing. Whether you're a nurse, whether you're a domestic, whether you're reception staff, whether you're a consultant, a doctor, everyone just has a can-do attitude, and roles evolve, and that's just what we're seeing in COVID, where we've got ACPs doing ultrasounding of lungs to look for various signs of COVID, and even in business as usual, just everyone just mucks in and just does the best for the patient.
Absolutely. And I think we should also mention, because of your relationship with St John Ambulance, how amazing they are. And we've had, I've had some of the people I've met and said, you're volunteering, you're helping here. What is your background? They've come from, you've got bartender working here, volunteering. We've got someone who's a cyclist. It's very interesting how people are pulling together at this time, and how important their role is actually in helping us with a smooth running of the department.
I've been in St John Ambulance for many years. The volunteers we see are just amazing. They go above and beyond. They're giving their time for free in business as usual and part of the COVID response to support the communities and the NHS. And yet they come from all different walks of life. They're very well trained. For COVID especially, we've done upskilling for some of our volunteers to prepare them and make sure that they're fit to stand with us on the front line.
Absolutely. Thank you, Peter, for your time.
You're welcome.
Let's go and speak to some other people and find out more experiences.
Bye.
So guys, I've just jumped into one of the kind of side rooms with Carol. She's a matron here. I've known her for many years, and she's dealt, I think, fantastically with what we've kind of had to face. Carol, I thought maybe you could kind of comment on how varied some of the roles have been for nurses and how they've kind of had to adapt to the situation.
We've had to change the way we work. We've had to work in very different areas. We've had to work in very different ways. Some of the work has stayed quite similar, but the way in which we're working, where we're working, has altered. Certainly we have never dealt with as many people, as very many sick people at once in full PPE, and that's actually been really quite difficult.
Yeah.
It is quite difficult to wear for a long period of time, and it isn't always possible to rotate staff in those areas as quickly as you'd like to. So sometimes they're in there for quite a long time. It's very hot, it's very hard, and they've been absolutely brilliant, extremely positive about it. We've also had to use some of our teams differently, so we've had St John's Ambulance working with us.
Who've done a fantastic job, by the way.
They really have. Our nurse practitioners have worked in different ways. They have sort of managed the front end of things, the urgent care side of things, so we could pull back the nursing staff into the more critical care areas. And the advanced clinical practitioners have worked differently as well, helping us run certain areas, particularly things like green resus, because we've had to split resus into red and green.
I think what's amazing, and I always say this, nurses are the backbone of the NHS. We literally can't do this without them. They have such varied roles. I think the kind of typical idea of what a nurse is or was is very different to the reality of it. They do virtually everything. We work together so closely, and I feel very lucky to work with such a fantastic team. I'm sure you'd like to echo those thoughts. And also, with regards to kind of moving forward, over the future kind of weeks and months, is there an element you think of us having to support staff with things that we've seen?
I think so. We're already using people in a different way. There are some things that we are doing now that we all know we would like to carry on, and we're currently reviewing that right now, not just in ED but in other areas too. But some very positive ways of working have come out of this, and it would be good if we can keep some of that. But the teamwork, we could never have done any of this without the teamwork, and the team have been absolutely amazing.
They have been fantastic. We're very lucky to have incredible staff, and the nurses do a brilliant job. I hope this gives you a useful insight into kind of the role of nursing, how they've dealt with this pandemic. I think they've done incredibly well, and we're very grateful to them. If you're interested in the career in nursing, absolutely look into it, because it is amazing. You can do virtually anything you want with it, whether you want to research, whether you want to be in A&E, whether you want to be in intensive care, you can work in GP practices. Have a look, because it is an incredible career. Thanks so much for watching this episode. Take care, everyone. Stay safe. Please do remember to comment, like, and subscribe. Do those usual bits and pieces. Take care and see you soon. Bye bye.